Hi, Strong Mom Society. So we're going to do something a little bit different today, and this workout is great for anyone that has any kind of pelvic girdle pain, symphysis pubis dysfunction, SI joint pain, anything going on in the hips, pelvis, or pelvic floor. If you tend to hold tension in the pelvic floor, you're working through a prolapse, any kind of discomfort after giving birth, this is a great series for you to work through because we're going to be not working with the pelvic floor muscles, but we're going to be talking about the pelvic floor fascia. And there are 5 layers of the pelvic floor fascia. And before we can really get into moving that fascia around, we have to go into our brains because it doesn't move, it doesn't flex and extend and contract and relax like the muscles in our body. It's connective tissue. So I want you to really try to visualize the prompts that I'm giving you, and that's how we're going to get to that fascia, through our brains, not through, moving, lifting, gripping, or squeezing those muscles in the pelvic floor like this, like we're used to. So the first thing I want you to do is actually just stand here, hip width apart. Close your eyes. I want you to stack so your weight's dropping right down through the center of your feet. There's a little bit of a bend in your knees, not enough to be awkward, just enough to not be locked out. And then imagine that pelvis is in neutral right on top of the center of your feet. That tailbone's nice and heavy dropping down. Your ribs are on top of your hips. Shoulders are open, not rounding forward. And then your head's just a balloon floating on top of your spine. And I want you to bring your hands to your belly. We're going to start with that diaphragmatic breath. So you inhale, fill ribs and belly, exhale, just let go. Don't worry about that pelvic floor lift or that belly wrap. The important thing here is that we get that diaphragm lengthening in on the inhale, moving back up underneath the ribs on the exhale. Check in, make sure you're not holding any tension in your body. I want you to take your knuckles and I want you to just start to tap through that area of the diaphragm. So your bottom 2 ribs, you're gonna start at the front, work around to the sides and into your back body. And then what you're gonna do is tap into your lower back, down into the pelvis, the SI joint, the sacrum, the glutes. I want you to tap all the way down your legs, up, down the outsides, up the insides. And just think of, kind of warming up all the fascial systems in the body here. You're trying to touch every single bit of fascia. We're going to come up into the arm. I want you to start with the right arm. So start at the fingertips, come all the way up into the trap, come down around the outside, the inside. Then what you're going to do is imagine that you're wearing a sleeve and you're just going to swipe that sleeve from top to bottom off the fingertips. Give that arm a really hard shake. I want you to feel that rebound. And then you're going to put that rebound or that shake into the leg on the same side. And then I want you to come back to center, close your eyes a second, and I want you to notice how this right side of your body, arm and leg, feel a little bit different than the left. Maybe they're a little tingly, maybe they feel a little more grounded. Go ahead, open your eyes, come into the right arm. You're going to come up into the trap. Tapping all around the arm, tapping that fascial system. Again, you've got that sleeve, you're gonna swipe it all the way down off your fingertips. Give that arm a nice hard shake. Feel that rebound or that reverberation at the bottom. Same thing with that left leg. Come back to center, close your eyes. Now feel that. Just a little more awareness on that left side of the body. They should feel a little more even now. And I want you to open your eyes and I want you to lift your shoulders up and down. And here's where we're going to get into that visualization. Your shoulders, I want you to imagine, are underneath some really heavy rocks. So in order to get those shoulders up, I want you to visualize that you have to push those rocks up and apply a little bit of force as on that lift and on the way down. So you don't want those rocks to completely crush you on the way down. You kind of have to resist the way up and the way down to push them up and push them down. Now just feel the tension that's created in your body from using that as a visual. You're just thinking about those heavy rocks. And then what I want you to do is imagine that your shoulders are completely weightless. They're feathers and lots of lubrication, Lots of mobility. They're gonna lift and lower here. A few times. Go back to the rocks. Lift them up. Feel that tension, how it builds. This is the same movement in your body. All you're doing is changing the image that you're playing with. And then shoulders go up and down. Feathers, they're in water. They're weightless here. So we want to think of the muscles of our pelvic floor and that pelvic floor fascia in the same way. Usually when we have any kind of discomfort or pain, we tend to grip and hold and kind of muscle through things because of that discomfort. Well, it's just like this visualization here. If you imagine that things are really holding on to tension, they're going to hold on to tension. So when it comes to balancing the muscles of the pelvic floor, balancing that pelvic fascia, we want to feel that just things are, you know, even, lubricated. They have lots of mobility. They're not stuck. So what I want you to think of now is bowl of water as the pelvis, and you're just gonna slosh that water around. So you're gonna take a nice big circle. So trying to go front side, back side, all the way around, and then take it the other direction. Breathe into this. Keep using that diaphragmatic breath. That diaphragm's really important for getting into that fascial system because we want to make sure that we're in rest and recovery. We're not in fight or flight holding tension. And then I want you to slosh that water forward, tip it out the back of the pelvis, and then take the water out the front of the pelvis. Out the back, out the front. Out the back. You might notice that this is an exercise that we do a lot with pelvic tucking, pelvic tilts to get that mobility in the pelvis. And usually when we do it, we're thinking about the muscles of the pelvic floor. I don't want you to think about lifting that pelvic floor to go into that tuck. I want you to just think of that water spilling out the front and the back. And then go back to that, sloshing around. Now you're gonna take yourself for a walk. So I want you to just get into that nice loose feeling and just walk yourself around the room and practice that diaphragmatic breathing while you're walking, you're in motion. So you can even put a hand here. We've got the pelvic floor at the bottom of the dome, the canister, the diaphragm at the top. And as we breathe in, everything lengthens down. As we breathe out, so you're just gonna take your hands like this. And you're just visualizing that nice fluid breath as you walk around. And again, all we're trying to do here is release that tension that we tend to hold in the pelvic floor and come back to center. Good. I want you to find your sits bones. So if you were sitting on a very hard seat, very upright, straight spine, and you kind of give yourself a little rock from side to side, you would feel two bony points at the bottom of your pelvis. You're just gonna take your hands and you're gonna put your hands in the area of the sits bones. If you can't find them, that's okay. And you're just gonna visualize those 2 points. Put a dab of paint here and a dab of paint here. And you're gonna bend forward and back. And all you're gonna do is imagine first that those dabs of paint are gonna touch the back wall behind you and then slip underneath you again. Now I want you to take the focus off of paint. That's just to get you into that hinge, and visualize those bones, those two sits bones, as we move out and back or flex at the hips. Those sits bones, millimeters, very tiny movement, actually move out and widen. And then when we stand up, they move in and they narrow. So I want you to think out and wide, in and narrow. Out and wide, in and narrow. Back and wide, short and narrow. Back and wide, short and narrow. And all I want you to think about now is how those pelvic floor muscles attach to all the bony points of our pelvis. So we have those sits bones, and if the sits bones are moving out and wide, the muscles that are connected to those bony points are also going to lengthen. And then when we stand up, when those bones shorten, the pelvic floor muscles are going to take a little bit of tone. No need to Kegel, no need to hold tension. The muscles are going to lengthen and tone naturally because of the way that you're moving the bones in the body. So the pelvic floor lengthens, pelvic floor tones. Sits bones out and wide, pelvic floor lengthens. Sits bones short and narrow, pelvic floor tones. Out and wide, lengthen, short and narrow, tone. Take that one more time. Out and wide and short and narrow. Good. We're gonna just touch the right sits bone. So right side only, and I want you to think of that right sits bone moving out and back and wide, short and narrow. So we're just focusing on that one side. If you do tend to have pain on one SI joint, one side of the pelvis, anything happening in the pelvic floor on one side, this is great for rebalancing. Then the second move in this little series here is going to be to lift that leg up underneath you. So sits bone goes out and wide, it goes short and narrow, and then there's just a gust of wind behind your knee to lift it up. You can also imagine there's a force from that sits bone that's just allowing that leg to lift with very little effort. Sits bone out and wide, the pelvic floor lengthens. In and under, the pelvic floor tones. Third move is to lift that leg up, take it out to the side. So you're gonna take a little side step, press your weight into the heel. Think heel to pelvic floor on the right side here to return. So again, that's out and wide, gust of wind, press into the heel to pelvic floor to return. Out and wide, gust of wind, press into the heel to pelvic floor to return. One more time, out and wide, gust of wind, heel to pelvic floor to return. I want you to take your hand off of that right sits bone, walk yourself around, and I want you to just notice if there's a difference between your gait on the right leg and the left leg. You might feel a little bit of tingliness around the area that you were touching with the sits bone. The leg might feel like it swings a little more freer. You might feel nothing at all. That's okay too. But you're just trying to see if you feel any difference from right to left. And then we're gonna go into the left side. So left hand on the left sits bone, out and back, in and under. That sits bone on the left goes out and back. The left side of the pelvic floor lengthens. It shortens and tones. Pelvic floor lengthens, pelvic floor tones. Take this one more time. Then we're gonna add that gust of wind behind the knee. So you feel that force, a little bit of wind. Pelvic floor lengthens, pelvic floor tones. Out and wide, short and narrow, gust of wind behind the knee. One more. Then we're gonna add that side step. So out and back, gust of wind, you're gonna step into that left heel, left foot, heel to left side of the pelvic floor to return. Sits bones go out and back, short and narrow. Press into your heel to pelvic floor to return. Out and back, short and narrow, heel to pelvic floor to return. Two more times, sits bones out, sits bones under, sits bones out, sits bones under. Pelvic floor lengthens, pelvic floor tones, pelvic floor lengthens, pelvic floor tones. Shake that hand out, walk yourself around the room again. See if you feel a little bit more balanced. You might feel that tingliness in the left sits bone this time. And come back to center. I want you to take one more release. We're gonna release what's called the internal obturator. So the internal obturator think of it as muscles that kind of line the bowl of the pelvis. We're gonna start on the right side. So you're gonna find that right sits bone with your right hand. Walk your hand up about an inch above that sits bone, and I want you to just press in with the pads of your fingers here. And what you're gonna do is imagine that you've got a bug underneath your foot, and you're just gonna squish as you press in with those fingers. So you can kind of, when you press in there, you'll feel a little bit of rotation of some muscles underneath your fingertips. And that's what we're trying to bring some just mobility to. So this area of the hip, pelvic floor, the pelvic fascia stops holding tension, and we're just allowing it to loosen up. Good, and then I want you to shake that out. Give yourself a walk around the room. See if there's a difference from right to left. And then we're gonna do the left side. So find that left sits bone, walk yourself up about an inch, press in. As you start to squish that bug, you can kind of move your fingertips around to feel for those muscles moving underneath your fingers. Squish, squish, squish. Holding your hands here is probably the hardest part of this entire series. Good, and then you're gonna shake that hand out, walk yourself around on this side. Good, I want you to come back to the center, close your eyes, and go back into that diaphragmatic breath. Think about lengthening your pelvic floor. find that alignment. Make sure your knees aren't locked out. And this is just series 1 for rebalancing that pelvic fascia, trying to get out of any kind of tension or pain that we hold in the area of the pelvis.